One of the things that's happening at the state level, I think, is an incredible amount of collaboration between behavioral health, public health, Medicaid, child welfare, other cabinets, justice and public safety, education.
Robust question-answer sessions, round-table discussions, and lots of note-taking. Those were 3 elements of Kentucky's first ever Harm Reduction Syringe Exchange Summit. It attracted more than 225 people from across the state. The Cabinet's Department for Public Health hosted the event in Lexington.
It's invited local health department leadership and anyone they want to bring around the whole concept of syringe exchange programs. We want to feature those syringe exchange programs which have been developed and going and learn from them, their barriers, their challenges, but also their best practices. In the room as well are counties and districts which do not have syringe exchange programs, and what we want to be able to do is help them, support them, encourage them in getting a syringe exchange program going. So it's not just about the needle. It's about folks being tested for HIV and hepatitis C. It's about getting folks into care if they're positive for HIV or hepatitis C. It is also around getting those individuals with substance use disorder into treatment for that substance use disorder, and we know that happens 5 times more frequently if they're engaged in a syringe exchange program.
Justice and Public Safety Cabinet Secretary John Tilley was one of several speakers. The Secretary touched on the unique dynamic between criminal justice and public health.
There's nothing more devastating than continuing to use a criminal justice hammer to treat a public health nightmare. And there's so many reasons for that. You exacerbate the problems the individual already has. We're dealing with someone who has a disease, who has an addiction. We need better community-based treatment, better intensive outpatient options. But when you entangle somebody in the criminal justice system, you increase the likelihood that they'll not recover from this disease as opposed to actually getting the treatment they need.